usually the young men who are diagnosed with testicular cancer, they worry about the loss of fertility that comes with this cancer. So they might want to have children in the future. So what are the options that are available to them to even maintain their fertility as well as continue with their treatment?
So men undergoing orchidectomy will have a normal libido. However, their ability to have children will come down. So, as a part of counseling, even before we start the treatment, what we recommend to these men is to undergo what is known as cryopreservation of semen, wherein we encourage the affected men to collect a sample of their semen and get it cryopreserved in liquid nitrogen, which can go on and on and on perpetually without affecting the quality of the sperms. They can subsequently undergo treatment, and even with chemotherapy, their ability to have children comes down drastically. However, most of these men, once are declared cured, can consider the option of having in vitro fertilization, or more commonly more popularly what we call as a test tube baby, which is become a very common procedure nowadays, and can have normal children. So all patients with testicular tumors who are contemplated for treatment are offered this semen banking before commencement of any treatment. At instances where this has not been done before the patient underwent a surgery, we definitely encourage them to preserve their semen at least before they start their chemotherapy. So this is an integral part of the treatment that we offer to patients with testicular tumors.
So, do the patients who are undergoing the treatments for this testicular cancer face any side effects? If yes, then how can they manage it?
If chemotherapy is involved, a majority of patients receiving chemotherapy will experience mild side effects throughout the course of chemotherapy and for a brief period thereafter. Unlike in the past, there are many strategies that we adopt to minimize these side effects and make them largely tolerable. So the clinicians who are doing the chemotherapy will evaluate patients from time to time before they commence each cycle of chemotherapy to ensure that the side effects are kept to the minimum. And whenever a particular side effect is persistent or troubling the patient, those modifications are done to make sure that the subsequent cycle will not affect the patient. We also skip utilization of certain drugs if the patients have particular side effects, and look at alternative treatment pathways to ensure that the side effects are kept to minimum.
I know, sir, you have answered this question before, but I would still want to reiterate this question. Is testicular cancer curable?
Testicular cancers have probably one of the highest opportunities for cure. And like I have also mentioned to you before, close to 100% of patients with testicular cancers are potentially completely cured long term. When I say long term, we are talking of 30 years, 40 years. Meaning to say, a young patient who came to us with testicular cancer, got treated appropriately, will probably never experience this disease again and will lead a completely normal life like any other individual. So it's important to know that though there is an event of testicular cancer, the treatment options are excellent and the treatment should be delivered by the right team to ensure that the cure rates are maximum.
So everyone would want to know to just prevent that disease before it comes. So is testicular cancer preventable?
I think we have discussed this in a different context in the discussion. So a vast majority of testicular cancers do not have an etiology. They do not have a causative factor. However, in a small proportion of patients who have an undescended testis, there is a higher risk for developing testicular cancer, and therefore one of the preventable strategies to reduce the risk of testicular cancer in children with undescended testes is to identify the problem and get the testis back into the scrotum where it belongs and fix it. And this has to be done as soon as possible, and like I mentioned, probably within the time the child completes its first birthday. So this is something that every parent should be aware of and should ensure that the child is evaluated properly by a pediatrician to make sure that there is no situation like an undescended testis.
Sir, since this is not a type of usual conversation that we have with our friends and family, men try to keep it away from their family, these health concerns, and usually they get hesitant to go to a doctor and get it checked if they have any such health concerns related to their testis. So as a specialist and as a doctor, what do you have to tell those men and as to what they can do?
Yeah, I think it's again very, very relevant question, because testis is private part, so people are not very forthcoming in announcing a problem there. Plus, there is also a sense of guilt or taboo that something that they have done has caused this. So it is very important to understand that it is totally unrelated to their lifestyle or living. And if any problem is noticed, they should just go to their family physicians, get themselves evaluated, who in turn will subsequently refer them to a urologist or a uro-oncologist for further evaluation. At this juncture, I would also want to highlight that many young boys, 15, 16 years, 18 years, who are adolescents, basically, will also develop testicular cancers. They would have probably crossed the age where parents monitor them physically, but these young adolescents may be hesitant to announce a problem to their parents because that's an age where they are becoming self-aware and self-conscious about themselves. So it is important to discuss about probable changes that can happen in a growing boy, and a parental casual conversation with the child, telling that in case you identify any difficulty or any swelling or whatever happening in your genital area, do not hesitate to talk to us. One reassuring conversation with the child will go a very long way. And this is probably very, very important, because if the child announces a problem in the early stages, the treatment can be very, very easily effected, not requiring multiple treatments like surgery, chemotherapy, radiotherapy, so on and so forth. A simple surgery will solve all the problems. So it is a very important question. Whoever has an issue should not feel shy to go to their doctors and evaluate. And the children should definitely be educated by the parents. I think the onus is really on the parents. Educated by the parents and keep them fear-free, so that they can very easily open up to their parents and announce a problem when there is one.
now that we have known about what is testicular cancer, then the early signs and symptoms of it, and our doctor also told about the cryopreservation of the semen, so that we also dwelt with the fertility issues that comes with the testicular cancer. We have gone through about the prevention, the treatment options. So I hope we are able to make you aware of testicular cancer on this Testicular Cancer Awareness Month. And I would like to thank Dr. Srivatsa sir for enlightening us about the testicular cancer. Thank you, sir.